Good afternoon to everyone, dear ladies and gentlemen, our friends from the press. Thank you so much. Thank you for joining us at this important gathering as we observe Lung Cancer Awareness Month. Before I say anything further, I'd also like to acknowledge the partnership which we've crafted here with the Philippine Cancer Society and Dr. Rachel Rosario. Thank you so much for being a part of this event. During the entire month of November, global efforts are highlighting the burden, risk factors, prevention, and proper treatment of lung cancer. In 2020, about 2.2 million diagnoses were reported. Lung cancer remains to be the most common cause of cancer-related mortality worldwide, with nearly 1.8 million deaths in 2020. Majority of the cases and deaths occur in Asia, followed by Europe. Treating patients suffering from lung cancer is challenging, especially because it involves late diagnosis, which in turn often leads to high mortality rates. Although the recent years have welcomed revolutionary changes in the management of lung cancer, there is still nothing better than emphasizing the importance of prevention. Through this forum, we hope to provide our friends in the media and with the help of PCS, a fruitful learning experience so that we can continue to strengthen all efforts to increase awareness on lung cancer, including its prevention, diagnosis, and treatment. Let's make Lung Cancer Awareness Month matter, not only every November, but the entire year around.
Moderator for this session. Dr. Peronelia Carlton is a medical oncologist whose special interest is in palliative and supportive care. She is a fellow of the Philippine Society of Medical Oncology and the Philippine College of Physicians. At the Cardinal Santos Medical Center, she is a doctor champion of the Cancer Registry or CARE Philippines, member of both the Institutional Ethics Review Board and the Palliative Care and Hospital Unit Core Team of Physicians, as well as advisor for the Cancer Patients Group. In 2018, she received the International Development and Education Award in Palliative Care from the American Society of Clinical Oncology. Please welcome Dr. Pauline Ann Peronelia Carlton.
Honor and privilege to be with everyone this afternoon. And we're hoping that whatever brought you here in this time, in this place, to be at this session, we hope that by the end, you will have a better hold, a better picture of what cancer is and all the many things that we are doing that we can do about it. Especially now, during the Lung Cancer Awareness Week, it's the perfect time to have our distinguished speakers to share with us the fundamentals of this serious but very relevant disease, including its signs, symptoms, screening, and treatment. So firstly, we have with us today Dr. Christine Chavez. Okay, so Dr. Chavez is a specialist in clinical and interventional pulmonology. She is a consultant and training officer for fellowship at the Medical City Hospital section of pulmonology. Dr. Chavez is also affiliated with Cardinal Santos Medical Center, and her professional memberships include the World Association for Bronchology and Interventional Pulmonology, the European Respiratory Society, and the Philippine Medical Association. She is a diplomat and fellow of the Philippine College of Chest Physicians as well as the Philippine College of Physicians. So let's kick off this afternoon session with the presentation of Dr. Christine Chavez, Lung Cancer 101, Signs, Symptoms, and Screening.
Thank you to AstraZeneca and the Philippine Cancer Society for this privilege to share our advocacy on decreasing the mortality from lung cancer. So I was asked today to describe the signs and symptoms of lung cancer, and what is the screening tool to diagnose or detect lung cancer early. So, as mentioned a while ago, globally, lung cancer is second to breast as the most common cancer. It is second to breast. But as a cause of cancer death, lung is the top cause of death among all cancers. In the Philippines, this is also the case. Lung is the most common cancer with 19,000 new cases in 2020, but is the top cause of death from lung cancers among all cancers, with approximately 17,000 of people dying from the disease. So we cannot underscore the fact that lung cancer is a deadly disease, especially when it's diagnosed at the late stages. You can see here that in a study on the number of patients within 5 years, so these are the number of people who were diagnosed to have lung cancer. Among everyone who were diagnosed to have lung cancer, only 22.9, the green ones, were able to survive within 5 years after cancer diagnosis. Why is this the case? Because a majority of the cases at present are diagnosed at the late stage already of the disease. So if you can see here, 55% of all patients who are diagnosed to have cancer are already in the advanced stage of the disease, and only few were diagnosed in the early stage. The early stage being the stage where we can do more and we can control or possibly cure lung cancer better. So here, you can see that the percentage of patients who survive within 5 years is really low if the cancer has already spread compared with patients who have lung cancer that are only localized. So what causes lung cancer? Smoking remains the most common cause of lung cancer. But it is still also important to know that over 50% of women and some percentage of men can develop lung cancer even without the risk of having ever smoked. So anyone with lungs can be at risk for lung cancer. Why is that so? Because there is there are also factors such as secondhand smoke exposure, indoor and outdoor air pollution, the pollution that we get from combustion of engines, and inside the house when in individuals who use biomass fuels for cooking. If you have a family member who has a history of lung or any cancer, and exposure to certain chemicals or pollution in the workplace, such as coal fumes, radon dust, asbestos, which is found in cement, or silica. So these are the risk factors. Smoking cigarettes is the most common risk factor, but these are also the common risk factors for developing lung cancer. So what are the common signs of lung cancer? Usually, when the cancer has already spread or is already increasing in size, there is persistent or worsening cough. Some patients cough up blood or rust-colored sputum or phlegm. There may be chest pain that persons with coughing. There may be persistent or recurring lung infections such as bronchitis or pneumonia. There may be hoarseness or loss of voice without any sore throat, breathlessness or wheezing sound, weight loss that is unintentional or unexplained, loss of appetite, and fatigue. So these are usually the common symptoms of lung cancer. However, I would like to emphasize that these symptoms that I mentioned are usually manifestations of late stage cancer. In the early stage of lung cancer, there are usually no symptoms. So, how do we go about that? Kung walang symptoms, paano natin ma-detect? We look at the risk factors. So usually, lung cancer, in the previous years, we used to do chest x-rays to detect lung cancer. However, there are most of the beginning lung cancer cases cannot be detected on x-ray alone. So there were studies that were done that compared X-ray and low dose computed tomography scan in detecting lung cancer. Because for a screening tool, like for example, in breast cancer and colon cancer, we already know the the tests to do to screen for those cancers, right? Mammography for breast and colonoscopy for colon. So for a screening tool to become effective, or for a diagnostic test to be recommended as a screening tool, it has to be proven to decrease the number of people who die from the disease. So in studies that have compared X-ray and low-dose chest CT scan, it was found that low-dose computed tomography or CT scan, low-dose CT scan, is the tool that decreased the number of people who died from lung cancer. So compared with a regular full-dose chest CT scan, low-dose chest CT scan has over 5 times lower amount of radiation emitted. This is hugely important, especially for individuals who have high risk factors for the disease or for lung cancer. This is what I was describing a while ago. Can you see this area? So this is an example of one patient that we've handled who had early stage lung cancer. The patient had risk factors, and on low dose CT scan, we found this abnormality on the lungs. This abnormality cannot be seen on X-ray. But when we screened using low dose chest CT scan, we were able to detect this. And eventually, the patient underwent surgery and has survived for a long time. So these were the studies that I mentioned a while ago. So both these studies showed that screening of high-risk individuals using low-dose chest CT scan decreased the number of people who died from lung cancer by 20 to 24%. So that is a significant amount, considering that lung cancer may be deadly in the late stage of the disease. So I mentioned about high-risk individuals and also the risk factors for lung cancer. So among the risk factors that I mentioned, these were the risk factors that were proven to be the eligibility criteria for low-dose chest CT scan. So in healthy individuals aged 50 to 75 years, with a heavy smoking history, heavy smoking, which is defined as smoking more than 15 cigarettes a day for more than 25 years, or more than 10 cigarettes a day for more than 30 years. If the individual has quit, that is good. But if the quit time is less than 10 years, still recommend to have low-dose chest CT screening done. Another factor is, of course, decreasing the risk. Among the risk factors that I mentioned a while ago, there are unmodifiables such as the genetic predisposition, your occupational exposure, but there are also risk factors that you can modify, which is the good thing is the most common cause of lung cancer, which is smoking, is a modifiable risk factor. So decreasing your risk for lung cancer is the key. Not having the disease is the key. But if you feel, or if you have a family friend, you have a family member or a friend who may be at high risk, then it is recommended to undergo screening so we can catch it early. So in summary, Lung cancer is the second most common cancer and is the top cause of cancer death globally and in the Philippines. Majority are diagnosed in the advanced stage, which has a poor survival. Smoking is the most important risk factors, but non-smokers can also develop lung cancer. Hopefully in the future, you will be able to find out which of those non-smoking risk factors may be included in the eligibility criteria for low-dose chest CT scan. Therefore, we would like to underscore that early diagnosis is key. Be aware of the signs and symptoms, and also know and lessen your risk factors. Lung cancer screening by low-dose chest CT scan can save lives, especially in high-risk individuals. So if you are at risk, get screened. Or if you know anyone, your family or your friends who may be at risk, advise them to get screened. Modify and lessen your risk factors. Thank you. If you have questions, I'm open to questions later, or you can get in touch with us through the number flashed on the screen.